Hello friends. So today our topic of discussion is habits. According to Dorland, habit is a fixed or constant practice established by frequent repetition. Many authors have classified the habits into various categories. Today we will be discussing the classification of habit in detail. So James in 1923 classified the habit into two categories, useful and the harmful. Useful habits are those which are useful for the human body, like respiration, deglutition, and harmful habits are tongue thrusting, mouth breathing, which is harmful for our oral cavity or our body. Then Finn in 1987 classified the habit into compulsive and non-compulsive. Compulsive, which is used by a child whenever his security is threatened, and non-compulsive habit, which is which shows the continuous behavior modification with age. Then coming to the clean in 1971 classified the habit into meaningful and empty. Meaningful habits are deep rooted, which is having psychological problem, whereas the empty habits are those which can be treated easily using the reminder therapy. Then the Morris and Bohana in 1969 classified the habit into three categories: pressure, non-pressure and biting. Pressure habit which creates pressure in the oral cavity like sucking, non-pressure habit which do not create any kind of pressure in the oral cavity like mouth breathing, and then biting habit like nail biting, nail chewing, etc. Then Kingsley in 1958 classified the habit into three categories: functional, muscular and combined. Functional habit are like mouth breathing, which is mainly occurs during the normal function of the body. Then muscular habits like lip sucking, tongue thrusting, and then combined, which combines both functional and the muscular habit. Then there are various other classification for habits. First is normal and abnormal. Normal habit, which is normal up to the 3 to 4 years of age group, and abnormal, which occurs after psychological period of cessation. Then the primary and the secondary habit. Primary habit, which is the main habit, occur because of the psychological reason, and then secondary habit, which has a supplemental problem like large tongue and adenoids. Then the psychological habits and pathological habits. Psychological habits like sucking in infancy, respiration. Pathological habits like because of large adenoids, nasal septal defect, etc. Then the other classification is retained and the cultivated habit. Retained habit, which is carried over from childhood to adulthood, and then cultivated habit, which occurs during socio-active life of an individual. So these are all are the classification of habit. In our next video we will be discussing the one by one thumb sucking habit in